guys, welcome back to my YouTube channel. This is me Muhammad Hassnain and welcome back to another video. So in our today's video we are going to discuss about a disease known as Bell's palsy. So firstly, what is Bell's palsy? So Bell's palsy is a disease. It's a type of facial paralysis that results in a temporary inability, means your face is unable to move the affected side, and it is a facial muscle weakness. It is an inability to control the facial muscles on the affected side of the face. Is this temporary? Then in most cases the weakness is temporary and it can improve over weeks. Bell's palsy has many symptoms and the symptoms can occur all of a sudden. So now let's talk about the causes of Bell's palsy. Although the original cause of Bell's palsy is unknown, but still there are some causes which are linked to it. For example, viral infections. For example, the herpes family, which is mainly related to this Bell's palsy, which is a viral infection. Another cause is the inflammation of the facial nerve, means swelling of the facial nerves. So the point where the nerve starts from can be inflamed and swelling. So what does the inflammation do? So the inflammation compresses the nerve, which leads to impaired nerve function. More causes include pressure on the facial nerve. So pressure on the facial nerve can also cause Bell's palsy. This pressure can result from swelling, which is caused due to inflammation, or it can be also because of trauma to the head, ear infection, or infection of the skull bone, which is near to the ear from where the facial nerve starts. Apart from the primary causes, there are also some risk factors which can contribute to Bell's palsy, and those risk factors include reproduction, diabetes, as people with diabetes experience, means they have circulatory problems which can cause inflammation, and then inflammation leads to Bell's palsy. And then high blood pressure is also a risk factor which can cause Bell's palsy. It is also similar to diabetes. High blood pressure can cause circulatory issues that might affect the facial nerve. More risk factors include obesity. It is also risk factor that can increase the chances of Bell's palsy, and upper respiratory infections, means the infection in the upper respiratory system can also trigger Bell's palsy. Even if the respiratory infection is very small, still it can trigger Bell's palsy, as the main cause of Bell's palsy is viral and infections. So these were the causes of Bell's palsy. Now let's discuss the symptoms of Bell's palsy. So as I told you that the symptoms of Bell's palsy can occur all of a sudden because of the causes. The symptoms include all of a sudden facial muscle weakness, means facial paralysis, and this paralysis can develop within 48 hours. This sudden weakness can cause to the inability to move one part of the face, the infected side. The next symptom is drooping of mouth. Drooping of mouth means that the mouth from the infected side, the lip from the infected side will droop, means it will seem to be fallen on one of the side. More symptoms include abnormal sensation or unusual sensation in the face, and also this can cause to facial pain, which would cause a pain in the affected side of the face. Another symptom is increased sensitivity to sound. So the affected side ear won't be able to hear very loud noises. So now let's talk about the diagnosis and treatment of Bell's palsy. So, first, if we talk about the diagnosis of Bell's palsy, then the doctor would do a neurological exam to check that what is causing the Bell's palsy and what is the reason behind it or which type of it. The diagnosis is done by excluding other conditions. For example, facial weakness, stroke, tumor, or infection. So they are excluded because they are also similar causes. So instead of these causes, the doctor uses medical history and clinical tests, for example, CT or MRI, to do the nerve studies. Even a electromyography test can be done to know about the nerve studies, and there is no single test to confirm about Bell's palsy, but these clinical tests can be done. Now let's talk about the medications and treatments of Bell's palsy. So, medications should be immediately taken and started to reduce inflammation and swelling from the facial nerve. They should be started within 3 days of symptom so that the recovery chances increase. Antiviral medications are also recommended so that the viral infection is suspected and recovered. Moreover, to reduce pain and facial pain, you can use pain relievers which help reduce pain in the facial nerves and face. As in Bell's palsy, the eye droops and the eyelid remains open because of the inability. So it is recommended to use eye drops to keep the eye moist and prevent any dryness, or to also prevent any debris going in the eye, or to even prevent injury as the eye remains open. An eye patch or a surgical tape should be used in the eye at night so that the eye can be kept closed and protected from any debris or injury. If we talk about physical treatments, then a physical therapy is recommended, which provides a facial massage and exercise which can help improve facial nerve function and muscle control in the face. In very severe cases, for example, permanent or severe dysfunction of the nerve, procedures like nerve transfers, muscle transfers, or other reconstructive surgeries may be done. If you notice any of the Bell's palsy symptoms, it is immediately recommended to seek medical help so that timely diagnosis can be applied and appropriate treatment can be done according to the cause and symptoms. And these type of matters should be immediately paid attention to so that the illness can be cured on time. So, this was all about Bell's palsy, its causes, symptoms, and treatments. I hope so that you find this video interesting and factual. Don't forget to like it and subscribe my channel for further videos. Thanks for watching.